asked me to talk about the Bookout Center, but I want to talk about another initiative that I've been running for about 15 years because I think there's a lot of lessons, and that's a meeting called Pumps and Pipes. And the reason it's important is it is the cardiovascular system, heart and vascular system, oil and gas. They use imaging, they navigate hollow tubes to access a target, they deliver volume flow from point A to point B, and NASA. And the reason it's important is because we call it a meeting of the curious. They're all smart people, but we speak a different language. And that's the challenge that you've really got here, is that you can communicate and not understand. We always say there's a sweet spot. When you look at it in a different direction, a dimension, you completely miss the opportunity to communicate concepts. And so we'd have the engineers would come in and they'd put up pages and pages of data. We're sleeping at that point in time. We are talking all medicalese, nobody understands. And so the communication is important. The relationships are how this is going to either fly or die. And you guys are going to be the translators for this and are going to have to help us with it. Because you need a certain level of comfort before I can say, Ash, I have no idea what in the hell you are talking about. And likewise to me, you don't want to talk down to people because everybody's smart, but because of that, we miss. And the opportunity to communicate, pretty rarefied. And if you miss that opportunity, that's a problem. The second problem to caution you about is us. Okay, I have no control over my time. He has no control over his time. Susan has no control over her time. You may be interested in heart disease, but when you get a call, the patient says, hey, I got chest pain. We don't have the luxury of saying, I'm really sorry, I can't see you because I'm going to meet one of these engineers over at Rice today in 15 minutes. And so we are incredibly frustrating people to work with. Don't take that as not interested. I tell you that on the Methodist side, there is enormous interest, and you bring huge value to us, but we have significant constraints in our ability to scale what our time is. And as a surgeon, it's particularly bad because we get called, we got to go to the operating room, we just got to do it. So I think this is doable. I think it's an exercise in translation. We used to say, show a picture, tell a story. Speak in language that doesn't sound like French or Russian or German to me. And if you can't understand it, say, I have no idea what the hell you're talking about. Please, hey, boil this down and give it to me in the appropriate level of communication. So I'm here to talk about another initiative, huge overlap potentially with this. The great thing about digital, you can touch anything. Our entire world is digital at Methodist at the moment. And I'm particularly interested basically in robotics and imaging. We'll talk a little bit about that. So what is the Bookout Center? The Bookout Center is a place. That place is called Mighty. How many of you have been up in the Mighty Center over at Methodist? All right, how many haven't? Okay, you got an open invitation to come over there. It's one of the more exciting. Think of it as a core lab. You can go in, you get to do things, see things. It encompasses imaging, it encompasses robotics, it encompasses simulation. Think of this as your extension from Rice to be able to practice and do the things, the hands-on kind of things that excites us all. Because one of the other lessons that I learned from Pumps and Pipes is if I stand up and explain in a way that you understand a problem with a patient, you can see the light bulbs going off with the engineers, okay? We take for granted the gratification that comes in taking care of people. We shouldn't, but we do, because that's what we do on a daily basis. But when engineers don't necessarily get that, and we know that that's incredibly empowering, and that's kind of what we want. You can help us deliver better care, and at the same time, you'll get the fulfillment of it. So the Bookout Center is a place that is mighty, and the hospital, and it's a concept of really using robotics and imaging, guidance and simulation. When you talk to the robotics and surgery can take us to this level. Imaging, we've got a bunch of imagers here, can take you to this level. When we combine these things and we use image-directed robotics, that can take us to do procedures that can't be done. Now, let me give you an example of that. Is that if you have a stroke and a blood clot goes up and goes into your brain, stroke doesn't kill you, but it will maim you for the rest of your life. And the most cost-effective intervention in medicine is for somebody to go through your groin, thread a catheter up in your brain, and suck out that blood clot. Now, if that happens to you in central Houston, you are replete with a number of centers who can do that for you. As I say, it can prevent you being paralyzed, and it prevents the societal burden that is associated with taking care of you, ultimately until the day that you die. But you don't have to go very far outside of Houston. You ain't going to get that. And so in the robotics world, I'll show you a little bit of an example if you have time to touch on that, is, we have imaging that can be done in multiple places. Catheter robots are being built at the moment, which could be controlled from the stroke centers to expedite moving this out into a more rural environment, away basically from the big centers. These are things that we're interested in. So the Bookout Center, I've talked to you a little bit about right now there's a surgical robotics program going over there. A bunch of people, Robert was over there basically yesterday. It's kind of a tech center, and we really want to invite you to come over there and to look at that. So it has evolved. It evolved from this concept of integrating imaging navigation. Now it's kind of this full-blown robotics center that we have there. Now, one of the things that I do is to look at what is the strength of our organization. Now, we have a lot of strengths. We have an imaging strength. We have a partnership with Siemens. We're the biggest Siemens install in the world. And we have lots of people who are doing robotics. We have liver transplants being done by robotic, kidney transplant, thoracic. If you get your lungs taken out, 95% of this is now done with a robot. We don't really have a whole lot of infrastructure for research in robotics. So we have this clinical expertise that spans a lot of specialties. And beyond that, of course, we have security robots that run all over the place. We got robots basically down in the labs. Robotics are transforming what we do, but we don't really have that basic science infrastructure. So the concept around the Bookout Center is, can I leverage the strength that we have in imaging, patient-specific, bring in the experts in robotics, and start building a core of people with visualization, with mechanical engineers with robotics, and figure out how we interact with a much bigger group of people. Marcia O'Malley's, for example, over here basically at Rice. You have expertise. We want to give you the access to practicing in your core lab, Mighty, and then rapidly seeing this basically move over into Methodist Hospital. And so we kind of modeled it after the Hamlin Institute. It's probably the foremost medical robotics center at Imperial College in London. We went over there. We tried to recruit the director. He can't come, but he's going to be a consultant into this. And so we have a space. We have funding, a chair for somebody who's going to be the director on the engineering part, basically, of robotics, and we will share that person, basically, with Rice. That's kind of the game plan going forward, because the advantage you have is they need postdocs. We don't really have the ability to hire people who are doing PhDs in engineering. We're going to have to partner with you in order to do that. And this is kind of the way that we see this thing basically evolve. We've started building our engineering core. These are the people, basically, who are already there at the moment and are helping to develop a number of these different programs. Hopefully, one day we have space up in the Research Institute. It's always about funding. Not looking at anybody in particular here, but if we get the money to do this, we'll build this out, because we want to put the engineers in Mighty next to where all these machines and the imaging and the research people are. And we want you to feel like you can come over to your lab here, run across the street, not feel like you're comfortable there, and basically participate in some of these exciting things that are going on there. So I will say to people, this is not my space. This is our space. And this could easily be the digital DHI hub where you start practicing things over at Methodist. And simple things that we've been done, we kind of mocked up. This is one of our what we call hybrid operating rooms. These are very expensive. We basically mocked this up in VR. I really don't like showing things like this now. I used to be very proud of this until Robert came along here, and now I kind of cringe at how amateurish this is compared with this kind of things that he's doing. But I can put one of our residents in there. We can train them in a radiation-free environment how to run these very sophisticated and complex machines. We can bring in, we film everything in an operating room. I could plug into my operating room here, let you see basically what's going on, and we collect data all the time, basically, when we're doing this. So we have a lot of technology that we probably could leverage a lot more from the point of view of doing research and education. A number of different projects basically going on at the Bookout Center. I'm not going to go through all of them, but really, what I really want to do is showcase the opportunities that there are, and to try and kind of break down some of these barriers in terms of worrying about moving over into a clinical space. This is the bridge to be able to do that. Simple example. Every one of those instruments gets washed by hand. And there's a message when you're developing new products, understand where our pain points are. Understand where our administration's pain point are. Understand what things get reported nationally. Falls. That's a benchmark thing that's reported, and we're on a scorecard. Instrumentation. This is an RFID tagged instruments that goes on the table. The table is a sensor. It counts these instruments. We have 200 instruments up there. We use 40 of them. They all get rewashed. A very simple way of creating data, incorporating into the workflow that's actually happening in an operating room, and then saying, do we really need Dr. Lumsden to sterilize 200 instruments? Could we have 40 of them on the table, 20 of them immediately available, and the rest are somewhere in the operating room, so we don't have to go through the cost. Very simple, effective way, basically, of doing that. That was the first time this has been done. Computer vision in the operating room. So I'll get a text any minute from a computer which says, your patient's in the operating room. That means get your butt over here within the next 20 to 30 minutes. That's really what it means. But that used to be done by the nurse. The nurse would sit down and type in, and that's time, and we pay for that. And it takes them away from doing bedside nursing things, much like some of the ICU things that Karan was talking about. The value of bedside nursing was brought home during COVID when we didn't have enough nurses. And a lot of these things were galvanized at that time. How do we take away the mundane, laborious things? You're going to hear about ambience, I see this afternoon, and transform my life. You know, because, I used to be, I'm Scottish, I have an accent. It used to be that didn't work very well for me. Now we walk in and see a patient, put this little thing down on the table, talk to the patient, talk about how the Texans did yesterday. It ignores that. How's your family doing? Somehow or other ignores that and creates basically a note that is remarkably good. Can do it in multiple different languages, translate it for me. And so these are the simple things that, is it meaningful? Does it make our workflow easier? And is it something that's scalable across the enterprise? So these are things that we use to improve our efficiency. Extended reality, I think Robert, you're going to hear from Robert Lekimwa this afternoon. He's jointly Methodist, big part race, little part Methodist, but we'll get our fair share out of you. Because he can really, VR and AR is something that will transform the way that we practice cases, educate residents, and communicate internationally. We built a system called the Mightyverse where we can take a heart, the Dr. Zogby's team do the scans on it, we can segment out the heart, we can put it in the Mightyverse, and you can have surgeons from across the world looking at it and talking to one another. These are the kind of things that can be scalable. I think I'm probably about out of time. This was actually an example of that catheter robot. We kind of built a robot to run a robot, but it would allow you to actually go up and suck blood out of the head. So this technology summit is going on over there at the moment. I'm going to close with just a simple example from this week. And this is the advantage of Mighty. This is a robot we don't have. It was built in Pisa from the mechanical engineering school there. This is one of our plastic surgeons sitting, doing what surgeons do. The interface here is fascinating. There's an electromechanical field around the seat that he's in. He's sitting there using instruments, and he's sewing a blood vessel together that is 1 millimeter in diameter. But it's scaled up. And that robot measures your tremor, extracts your tremor, and allows you to have steady hands to do this. And so top right is probably the most practical example of over there at the moment. Dr. Zogby, you'd be interested in this. This is a remotely controlled ultrasound probe. And the idea behind this is that we could have a central group of technologists who are going to run this. You scan somebody's carotid artery of the heart. We can do this remotely. In places that don't have it, it could be interpreted by basically folks downtown. And it's really a pretty simple robot, actually invented by a cardiologist. Now that's hard to believe, isn't it? We always have to, have a healthy tension between the cardiologists and the surgeons. But again, this is a beautiful example. Down to the bottom, of course, is 3D imaging. So I'm going to stop at that point and say, we would love for you guys to come over and tour the Mighty, what's going to happen with the Bookout Center, and explore how this interacts really with the digital health initiative, because the interaction potentially. Everything a robot does is math. I am not a math genius. I need a math translator to help me understand what it is we're doing. So thank you again for the opportunity to present today.